Good afternoon and welcome to the COVID-19 update on Channels Television. It's a daily update on the coronavirus pandemic in Nigeria and across the world. I'm Millicent Walker. First, some of the highlights. Today, anxiety mounts as confirmed COVID-19 cases in Nigeria nears 3,000 mark. The National Assembly sits today. Our correspondent joins us on expectations as the Control of Infectious Diseases Bill enters third reading in the House of Representatives. And countries lift restrictions. Coronavirus deaths past 250,000, according to the Johns Hopkins University. Now, there seems to be a consensus that unless, as a nation, citizens follow the guidelines on COVID-19 provided by the Nigeria Center for Disease Control, there may just be an unprecedented spike in a matter of weeks, following the videos and scenes of yesterday when the curfew was eased from 8 p.m. to 6 a.m., the mandatory provision of hand-washing facilities, sanitizers in all public places, the ban on interstate movement, except for essential travels and services, and the no gathering of more than 20 people outside of a workplace. This is for states like Abuja, Lagos, and other states. Well, the Director General of the NCDC, Mr. Chikwe Hekwazu, appealed to individuals and corporate organizations to take responsibility so that the exposure and transmission of the virus can be properly managed. According to him, the Presidential Task Force will hope that Nigerians will learn how to normalize going about daily lives while also adhering to the preventive measures advised by government. So how can businesses work out this measure to keep the virus at bay? And what is expected of the security agencies as they enforce compliance? That's our focus a little later today. 245 new cases of COVID-19 were confirmed in Nigeria by the Nigeria Center for Disease Control, NCDC, bringing the total cases in the country to 2,802. The NCDC also said that 417 patients have been discharged and a total of 93 deaths recorded. Of the 245 new cases, 76 are at the epicenter, that's Lagos, 37 in Katsina, 32 in Jigawa, 23 in Kano, and 19 in the Federal Capital Territory. Borno has 18, Edo 10, Bauchi 9, Adamawa 6, Oyo and Ogun 5 each, while Ekiti, Osun, Benue, Niger, and Zamfara got 1 cases each. Currently, Lagos has the highest infections in the southwest in the entire country, with a total of 1,183 cases, followed by Kano, the highest in the northwest, 365 cases. Next is the Federal Capital Territory, North Central. Borno has the highest figure in the northeast. Edo leads the states in the south-south, and Enugu leads in the southeast with 8 cases. The Benue state government has advised indigents of the state's residents in other parts of the country to remain where they are following the confirmation of another COVID-19 case in the state who fled from Kano to Benue late last month. Governor Samuel Otom, who identified the person as Edward Manja, a personnel of the National Drug Law Enforcement Agency deployed to Kano State, saying that anyone who has had contact with him when he traveled to the state, family members or other associates, that they should immediately isolate themselves in the interest of public safety. He insists the idea of naming the individual is for the interest of public health and to help the people understand the need to be cautious, obeying all safety measures like social distancing, regular hand washing, and avoiding large gathering.
Just yesterday, after samples were taken to Abuja, and the National Center for Disease Control confirmed him positive. There is no need to stigmatize anyone with COVID-19. This is a strange thing that came to us. We don't know where it's coming. There is no known cure, but there are other preventive measures that can be taken. And so when we mention people's names, is for the interests of the society, so that they will know. And anybody who have made contact with him when he came from towards the end of April up to yesterday. If you made contact with him, it will be in your own interest to come forward. Our medical team are here to assess you, isolate you for a while, take your samples, go to Abuja and do the testing. And if you're negative, that's all. But if you're not, we won't abandon you. We're ready to effect the treatment here in Benue State University Teaching Hospital or in Federal Medical Center. So it is not something to be ashamed of.
Let's go over to Kaduna State, where the government has revealed that it is treating 72 COVID-19 patients in the state, out of which 67 of them are Al-Majiri children who recently returned from Kano State. According to the government, 7 other cases on admission are persons with travel history outside Kaduna or their contacts. Now, out of the numbers are 2 policemen who are undergoing treatment at the state's Infectious Disease Control Center. And as the National Assembly resumes, the leadership of the House of Representatives is denying that it had received $10 million to pass the Control of Infectious Diseases bill. The Speaker says the allegations are weighty and the House will be taking legal action. We understand that some members of the Presidential Task Force, led by the Chairman, Boss Mustafa, have been admitted to the Representatives' chambers for an update. Well, we have our correspondent joining us now, Linda Kibe, for an update. Hello, Linda.
Don't remove my glasses. It's okay.
Good to see you, Linda. Give us an update as to the Senate or the House of Representatives and their activities for today.
Okay, hi, Millicent. So the Senate and the House of Representatives have resumed plenary session for today. Now, recall that the Senate refused, at the last plenary session, the Senate adjourned sine die. But interestingly, the Senate has convened plenary again, as against what they said that they were not going to be sitting unless there's something very, very important or an emergency or emergency issues to be deliberated upon. Now, right now, what we're saying in the Senate is that a bill for infectious disease bill has been introduced in the Senate. The bill is sponsored by Senator Chukwuma Utazi from Enugu State. Now, recall that a similar bill was introduced in the House of Reps last week, but at this moment, it is not clear if this bill is the same as the infectious diseases bill, which was sponsored by the House of Reps Speaker Femi Gbajabiamila. That bill passed first and second reading last week in the House of Representatives. Like you know, there's been a lot of public outcry about the manner in which the bill was passed, with some lawmakers in the House of Representatives saying that they did not see the details of the bill before it passed first and second reading, and the bill almost passed third reading, but that uproar prompted the House Speaker to step down the bill for third reading. However, at the Senate today, even after this bill was introduced in the Senate, we saw the former Deputy Senate President, Senator Ike Kweremadu, requesting that lawmakers that he needs to see a copy of the bill or the gazetted copy of this bill, which was introduced to the House of Representatives before consideration. However, the Senate President agreed with him that copies of the bill will be made available, or the gazetted copies, and he has requested that gazetted copies of the bill should be made available to senators for them to have the details of the bill before further consideration. But the difference is that in the Senate, the process is not going to be like the House of Reps, where it was given expedited hearing. What has happened today is that the bill has only passed first reading. That's just listed. So it will come up in consequent days for second and third reading. Now, in the House of Representatives, going from the uproar, over that bill, Speaker Femi Gbajabiamila has bowed to pressure and has concluded that the infectious disease bill will be put for public hearing. The bill was passed first and second reading and not third reading last week, and is at the second read. It is after the second reading stage that that a public hearing will be organized for the bill before it passes third reading. Well, he has now said that the bill will be put for a public hearing before it can be passed for third reading. But he, however, disagreed with those who say that this is not the right time to enact such bill. Now, the House has scheduled that the bill will be speedily passed, soon, as opposed to how it was passed last week. So a public hearing will be conducted on the bill before it is passed.
So, Linda, is there anything new that you've seen or a difference, especially with these two bills? We're looking at the Control of Infectious Diseases Bill at the House of Representatives, and then the Infectious Disease Bill coming up at the Senate. Do you think that there will come a time when they will perhaps harmonize, or are they supposed to have two different objectives?
Now, at this point, we do not know the details of the bill which was just introduced at the Senate this morning. We don't know if it's the same as the infectious disease bill which was introduced in the House of Representatives. So the question about harmonization cannot be, we don't know that for now until we get details of that bill. But whichever bill passes would have to come to the other house. So if the infectious diseases bill passes in the House of Reps, it will need to come to the Senate for harmonization or concurrence for it to be passed. And if this bill in the Senate passes, it will have to come vice versa to the House of Representatives. So, but for now, we can't say what the details of the bill that was introduced in the Senate, whether it's the same bill that was introduced in the House of Reps.
We also understand that members of the PTF are meeting. They've been admitted to the House of Representative chambers. Do we know exactly why this is? A deviation we hear from the resolution of the House last week for the Committee on the Healthcare Services to engage with the Presidential Task Force Committee.
Yes, like you said, it is a deviation. Last week, the committee, the members of the PTF were expected to meet with the committee, but today there was no warning and no reason given why members of the PTF are meeting as we speak. The meeting is currently ongoing at the House of Reps chamber. There's no reason given as to why this has happened. But I'm sure by the end of plenary today, we'll get more details of what that meeting is about. Our House of Reps correspondent is presently covering that meeting, and he will be able to tell us why the House of Reps changed its resolution for the PTF members to brief lawmakers at plenary instead at the committee level.
A quick one, Linda, and that is on your way to the National Assembly and perhaps also around the National Assembly, how much physical distancing is going on? And, you know, in terms of the regulations to wearing of the face mask, are you noticing?
Okay, yes, so there's strict compliance around the National Assembly, and even we do not have the kind of numbers the number of people we would typically expect in the National Assembly during a legislative day. There's been a reduced number of people coming to the National Assembly. Many of quite a number of civil servants, those who work in the National Assembly, are not working presently, and that is in compliance with the memo by the Clerk of the National Assembly that some grades of workers should not come to the National Assembly for now. And even journalists, not all journalists have been allowed to come into the National Assembly. There is a list of journalists required to come into the National Assembly. Even legislative aides are not all required to come to the National Assembly for now. So right now we have reduced numbers. There's social distancing. We've seen lawmakers comply with wearing their mask and practice physical distancing inside the Senate chamber, and even around the National Assembly. Lots of people are wearing face masks and complying generally.
All right. Well, I should thank you, Linda Akigbe, a National Assembly correspondent. Thanks for joining us. And across the states, the cases of COVID-19 pandemic rises in one particular state, 1 to 12, with one fatality. That's Zamfara. The state government has imposed a dusk to dawn curfew in Kaura and Namoda local government area for a period of 1 week following the death of the Emir of Kaura and Namoda, Alhaji Mohammed Asha, who died on Sunday from suspected COVID-19 complications. In a state broadcast, the state governor, Mr. Bello Matawale, also ordered for the immediate closure of all markets, excluding those selling foodstuff and medicals. The governor directs security agencies to enforce the order with immediate effect. In Yola, the Adamawa State capital, the Northeast Development Commission distributed 3 ambulances, medical equipment and food items to the Adamawa State government. The managing director, Mr. Mohammed Al-Khali, while making the presentations to the government, says part of the items are in fulfillment of a request made to the commission by the Adamawa State government after the attack on Garkida community by insurgents. According to the commission, the food items are palliatives and to complement the efforts of the COVID-19 Containment Committee in the state. In the southeast, following the federal government's easing of the lockdown with the 8 p.m. to 6 a.m. curfew, the Enugu state government has embarked on boundary inspection to ensure full compliance with the interstate lockdown. At the 4 entry points through Anambra and 1 into Ebonyi, the deputy governor, Mrs. Cecilia Ezilo, shared face masks, sanitizers and edibles to security men at the post, appealing to them to ensure strict compliance. According to her, proper enforcement at the borders will go a long way in curbing the spread of COVID-19 and ensure the safety of Enugu citizens and the sister states. Ogun State government is aggressively pursuing agricultural development to reshape the state's economy and ensure food security in the face of the ongoing coronavirus pandemic. At the flag-off of the 2020 planting season and inputs distribution to about 3,500 people, the Anchors Borrowers Program, the governor, Dapo Abiodun, seized the occasion to challenge youths in the state to embrace agriculture following the dwindling fortunes of oil in the international market. Let's talk some more about fighting the pandemic. And joining us right now via Skype is Dr. Abdulaziz Bako, a PhD candidate in the Indiana University. We'd like to thank you for joining us at this time. Let's begin by asking you about the states where you are and how they are battling the spread of COVID-19.
Thank you for having me. I'm in Indiana, Indianapolis, and we are in the stage where we have a lot of cases of COVID-19, and the state is getting ready to reopen, but they will not reopen until they are sure that they have enough testing capacity and also having some research going on about the denominator for the infection, at least knowing the extent of community transmission of the disease. They want to open when all these things are done.
So maybe looking at the angle of politics, the U.S. government, especially the administration of President Trump, has been criticized for slow response. But the president has also ramped up action in recent weeks, easing restrictions on testing vaccines, passing benefit packages for workers, employers. What's your take, and has that had any major impact?
I think it has some impact in terms of sending some palliatives to people who are struggling with hunger and poverty. That was really helpful, and a lot of people, it would help a lot of people because of the massive unemployment that has happened after the start of this pandemic going on in the United States. In terms of the testing capacity, a lot of states are complaining that the federal government is not up to par with the provision of testing capacity for them and some other medical facilities or medical equipment that they really need. And the federal government has not been so much helpful. There's a lot of politics going on there, but I want to stay out of it. I want to just mention that this is what the states are complaining about.
Okay. So let's talk about Nigeria. What's your assessment of how we're handling the pandemic?
So I will say that the federal government has started with some really good measures, but I think there's a lot of things that we have missed. The most important thing that we've missed was our testing capacity. We have not done enough to improve our ability to test people, to identify people that are infected with the disease, to isolate them and identify their contacts and isolate them. When we started this pandemic, our efforts were geared towards building isolation centers, and even the donors that we have been able to bring together. I believe that if they had an idea that testing capacity is a very important strategy that should be used to fight this pandemic, I believe in the beginning of the pandemic, we would have had testing capacity, especially in states with very large population like Kano State. Unfortunately, Kano State got its testing center much, much later into this pandemic.
Now you mentioned Kano. What's your take? Because initially we heard the number of unexplained deaths, and now they're saying that they might indeed be related or they've been attributed to COVID-19, and this is via verbal autopsy. I know you've done some research on that.
Yes, I actually was really concerned right at the start of the pandemic. I was concerned that lack of testing capacity will mean that a lot of people would be infected and we might not know until it is very late. So I was concerned that every time I go to social media, I see people mourning about their deceased persons, and I was concerned. So I started this investigation, asking people who lost their loved ones what happened to them, what are their symptoms. And from what I saw, a lot of people, close to 30 to 40%, have symptoms that are, that satisfy the clinical case definition of COVID-19 as defined by the NCDC. And that's really troubling to have. If we have a lot of people with that kind of, those kinds of constellation of symptoms, that is troubling. Another thing that I noticed from the research that I conducted was that a lot of people were not able to go to a hospital. They either go to the hospital and they are sent back, or they go to the hospital and they are not satisfied with the treatment that they have been.
So, Dr. Bako, we appear to have lost a bit of audio there, but according to the center as well, we're hearing that despite the best efforts of state governments, no response measure to controlling COVID-19, that people need to take perhaps responsibility now. Well, what do you think? How much restriction is, in terms of compliance level, are you witnessing in the US? And this is when you compare it to yesterday's scenes of people coming out and not practicing the social distancing and other guidelines to prevent the spread of COVID-19?
So when it started, I think there is massive compliance. The compliance in the United States was spectacular, especially at the beginning of it, when the states were announcing some stay-at-home orders. That was really complied with. Now there's a lot of protest in many states across the United States. So that might be a little violating, but to a large extent, there's a lot of compliance. And if I sort of, try to compare what is going on in the United States with what is going on in Nigeria, I will say that a lot of the things that happened are as a result of the government not thinking so much about what will incentivize people to stay at home, what will incentivize people to abide by the stay-at-home orders and the social distancing measures. For example, I'll give you a specific example in Kano State. When the stay-at-home order, or the lockdown, as you call it, was announced, there was a day that was given for people to come out, and that day came and everybody came out, and there was a lot of congestion in the whole state. That means that the state have not thought through this fact that when you open the state, this could happen. And there could have been some measures that could have been taken to reduce that kind of compaction and congestion.
All right, we appreciate your time analysis on this issue. Dr. Abdulaziz Bako, PhD candidate, Indiana University. Thank you for joining us.
Thank you very much.
And some 251,718 people around the world have now died from COVID-19, according to data compiled by Johns Hopkins University. The number of confirmed cases exceeds 3.5 million, while nearly 1.2 million people have recovered. Coronavirus deaths in the United Kingdom have surpassed the 30,000 mark, the highest in Europe, this according to official data. Take responsibility in protecting your health. The NCDC says you practice social distancing by non-contact greetings, maintain at least 2 meters or more between yourself and others. Stay home if you feel unwell. Call your state hotline. And the World Health Organization has rolling updates as well of the pandemic. That's a COVID-19 update at this time. Join us again for another update at 6 p.m. I'm Millicent Nwonka. Thanks for watching. Stay safe.